Hey everybody, today we're going to be covering epiglottitis. It is part of the pediatric series that is considered to be brand new. If you haven't watched my other series, you can find the playlist on my channel. So with epiglottitis, we're going to be covering the nursing interventions, the medications and medical treatment that's involved, the signs and symptoms that's associated with epiglottitis, the diagnostics that's associated with it, and some critical components to teach family members who are worried about their child who have this condition known as epiglottitis. Be sure to like this video, share it with your friends, and if you aren't subscribed, make sure to do that. So with that being said, let's get started. Alright, so what is epiglottitis? It is the inflammation of the epiglottis that is considered to be a life-threatening emergency. So the structure will cover and occlude the child's airway. So since this is considered to be a life-threatening emergency, it is extremely important to have the code card nearby the patient's room. So for in case if the patient's airway is occluded, you have the code card ready to go for access. So the ages this affects are from the range of 2 years to 8 years old. An important note to mention is that epiglottitis has decreased from vaccinations that have been given to the children. Something that's important to know is that epiglottitis is also caused by a bacterial infection known as Haemophilus influenza type B. It is not considered to be a viral infection, but it is considered to be a bacterial infection. So looking at the anatomical standpoint of the epiglottis, it's important to understand the mechanism of how it works. So what it is a flap of tissue that covers the larynx, also known as the voice box, at the entrance of the windpipe. And the function of it is to prevent any foods or liquids from going down the wrong pipe. So with this image here, I'm not the best artist, but bear with me. We have the epiglottis that sits on top of the larynx, and over here is our trachea. So what it does, it blocks off any foods or liquids from going down the wrong pipe. So normally food and water goes down the esophagus. So what it does, it blocks off any foods or liquids from going down the trachea into the respiratory system, and that could cause some severe infections. I will also post an image now to show you where the epiglottis is from an anatomical standpoint. So if epiglottitis isn't treated right away, a patient may lead into respiratory failure. Although it is a sad situation for a child to go into respiratory failure, as nursing students and future healthcare providers, it is very important to know the signs and symptoms associated with respiratory failure. So lucky for you, I have a mnemonic. Have you ever watched the episode of SpongeBob where, you know what, let me just show you really quick.
I don't need it. I don't need it. I don't need it. I need it!
Yes, that scene. So let me show you a mnemonic on how I remember respiratory failure. The mnemonic goes, SpongeBob could really learn some breathing techniques. So let me explain. So the S for sponge stands for status, or mental status change. For Bob is bobbing of the head. So the C in could stands for cyanosis and coughing. The RE in really stands for the RE in retractions. LE in learn stands for LE in lethargy. The S in sum stands for sitting forward, also known as the tripod position. Breathing stands for breathing quietly. The tech in techniques stands for tachycardia. This is just a mnemonic to remember respiratory failure. So respiratory failure is very detrimental, and it could occur from epiglottitis if it's not treated properly and right away. So this mnemonic will help you recognize the symptoms, so you could act very quick, grab that code card, and run to the patient's room if their airway is closed. How do you remember the signs and symptoms of epiglottitis? First off, let me tell you this. This is the first time you're ever going to see this on this channel, Tribe Nursing, because I created this mnemonic, if you want to say. Anyways, you're never going to forget it. The signs and symptoms are literally in the name. Let me explain for you. Okay, so the word epiglottitis. So if we take the letter I, we have inspiratory stridor. So the I in inspiratory. So let's take these two letter T's over here. We have tachycardia and tachypnea. So let's take this S over here and we have three things out of it. We have sudden onset, we have severe sore throat that is swollen cherry red, and then we have sitting forward. So we have sudden onset, severe sore throat that is swollen cherry red, and sitting forward. You have to remember the 3 D's. These, cross out the T's and put D's here instead. So 3 D's are drooling, dysphagia, and dysphonia. Dysphonia is difficulty in speaking. Dysphagia is a difficulty in swallowing, and drooling is just drooling. So remember, cross out the 3 T's, put 3 D's, and there you go. You have drooling, dysphagia, and dysphonia. And those are all the symptoms for epiglottitis. Okay, so how do you diagnose epiglottitis? Well, first thing you want to do to actually diagnose this disorder, you want to do a lateral x-ray. Lateral x-ray is taken from the side of the patient. This is going to help diagnose epiglottitis. So a patient will be lying still and the x-ray will literally take an image from their side. That's it. It's just a lateral x-ray. That's how you diagnose epiglottitis. Okay, so what are the nursing interventions associated with epiglottitis? Well, we need to monitor the child's respiratory status extremely closely. Like I mentioned before, this disorder causes something known as a laryngeal spasm, and when their airway is closed due to the inflammation of their epiglottis, it's going to occlude their airway, meaning their body is not getting the adequate amount of oxygen. Thus, the child is going to become cyanotic, they can become tachypnic, trying to breathe as much as possible. So it's extremely important to monitor the respiratory status. If the pulse ox, just continually watching it. You need to watch whether or not if it's desatting or not. Next nursing intervention is you want to encourage the child not to cry. So why would you want to encourage the child not to cry? Well, it's because we want to avoid laryngeal spasms. When the child is stressed and crying or coughing, what's going to happen is going to occlude the airway even more, causing a laryngeal spasm, meaning their larynx is going to spasm, it's going to close the airway, and now you have to prepare for emergency intubation, which leads to my next point, is that the code cart needs to be nearby for in case of an emergency intubation. If the child's airway is occluded, we need to intubate that patient so they have a mechanical airway so they can breathe properly. Patient should be hydrated via IV for precautionary measures. Also, something that's important, since disorders caused by a bacterial infection known as Haemophilus influenza type B, we need to have IV antibiotics ready to go and running to decrease the amount of inflammation and infection. Okay, so for family education, there are some things that you want to teach the parents about if they suspect epiglottitis. If the patient goes home with this disorder, if the parent does suspect epiglottitis, it's important to educate them about not sticking anything in the back of their throat, because what it's going to do, it's going to cause something known as a bronchospasm. What that's going to do, it's going to close their airway, and the child will not be getting proper oxygen perfusion throughout the rest of the body. Second thing is that you want to teach parents about proper antibiotic administration. You want to teach them that you must give all the antibiotics and just not stopping. And also, it's important to teach them how to give the medication. Also, you want to teach the parents about maintaining proper hydration. The reason this is important is because the child needs to be hydrated all the time. Since this is a stressful disorder, they have a higher chance of being dehydrated. So that's something important to keep in mind. So I hope you liked the video. If you did, make sure to hit the like button and subscribe button if you haven't already, and make sure to share this video with your friends. It will help a lot. So with that being said, thank you and have a great day.